Hi everyone. Very good evening to all of you and a very warm welcome to the webinar of mock test announcement and the NEET PG preparation strategy. So all of you did very well in the mock test. I don't have the result for now, but we can start with the webinar. As soon as we'll have results in my hand, I'll announce the results in between. Till then, we can start with the second part of the webinar, and that is the NEET PG preparation strategy. I have with me my very dear friends from Akash PG Plus, the faculty who has given their precious time on Sunday for the webinar. I welcome you all. I have with me Dr. Gurman, who is the biochemistry faculty in Akash PG Plus. I have Dr. Prachi, the pediatric faculty, and I have my friend Dr. Farheen, who is the Gynae faculty with me at Akash PG Plus. So let's start with the webinar on PG preparation strategy. Before discussing any strategy, I think the most important thing is to answer the big question. The big question which is surrounding your mind most of the time when you are a final year student or an intern. I know what the big question is because I have been through this time. So it is important to address that. And the big question is, what is the secret recipe? What is that secret recipe which is there with my room partner who has similar IQ like mine, who is dedicating similar amount of hours into the study, but still he's doing outstanding in the mock test, but I'm not. What is that secret recipe which is there with one of my batchmate who's active in the college politics, he's active in the college fest, and still he did very well compared to me in last year NEET PG, but I didn't. What is that secret recipe which I don't have? So before discussing this secret recipe, let's take a step back and understand the ingredients of this recipe. It's of no use of discussion of this recipe if we don't understand the ingredients. And let's call them the secret ingredients of success. So basically there are three ingredients. One is knowing your preparation, knowing the myths, knowing the facts, knowing the realities. There are certain things which we understand, which we know that they are not true. They are rumors going all around. We understand those myths somewhere in our heart. But unless and until something is said out loud, our brain does not listen to it. So that's what we'll do today. We'll clear your facts. We'll remove your myths by saying it out loud with example. Second ingredient, I cannot stress upon how important it is to practice. Whatever you have read is of no importance unless you practice. And third is the preparation strategy. Let's start the myths and facts. First myth, which is very common in the student population, is concepts versus fact. What we have heard a lot from our seniors is that this whole MBBS curriculum is based on concepts. Those who try to understand the concept behind anything are the winners. Those who are trying to memorizing everything, they are the one who take the backseat. So this is what is very prevalent. Do you know that in the MBBS curriculum, you are learning 5,000 new words? 5,000. It's like learning a new language. If you think you can learn this language just by applying concept to each and every word, to each and every line, you are gonna take huge amount of time, my friend, to understand this language. You have to apply concept, but you have to understand facts also. The sooner you accept it, better it is. Because then you will try moving around, try thinking of the various methods to learn the facts. And who can be the better faculty to deal with this than the biochemistry faculty? So I welcome Dr. Gurman to throw some light on this.
Thank you, Dr. Shefali. A very good evening, everyone. So today I'm going to give you a tip for your entrance exam. That is study harder, but smartly. So I'm not saying study smarter, not harder. I'm saying study harder, but smartly. So this means that you have to work hard. But when everyone is working hard, how will you get ahead of others? So for that, you need a strategy. So here we are going to discuss a strategy with which you can have effective learning outcomes. That is, you can have more outcomes from your efforts. So next slide, please. So under effective learning techniques, there are two methods of learning or preparing your topics, as you have around 5,000 topics to prepare. So one is concept based, that is based on your understanding. That is very important because of understanding, you can answer any type of question. But there are certain topics which are fact based learning also important. That is, you have to mug up. You have to mug up because you don't have enough time to make all the concepts, and moreover you will not have time in exam also to apply these concepts. So certain topics need to be mug up. They are fact based topics, and there are certain topics which needs both concept as well as fact. So like a question you have got in your exam about increased bilirubin levels, where conjugated bilirubin was raised along with alkaline phosphatase, and there were gallstones. So what was your answer? Yes, it was post-hepatic jaundice. But how will you prepare for this question? You will go for concept-based learning or fact-based learning. So, आप ये table को याद करोगे या you should have your concept, you should have your understanding. कैसे learn करोगे, कैसे answer करोगे? So, for me, this table to mug up this table is very difficult. Increase, normal. Moreover, if indirect question is asked, you will not be able to answer. Whereas concept making is easier here. So conjugated bilirubin is raised, that means, and unconjugated is near normal. That means liver is functioning normal, but due to alkaline phosphatase is raised, gallstones are there is some obstruction. So it is a case of post-hepatic jaundice. Similarly, there was other question in which it was cyanide inhibit which complex? Ab yahan kya karoge? You will answer based on your understanding or mugging. So here you can understand that cyanide is inhibiting complex 4 cytochrome C oxidase, but there is not one inhibitor. There is a list of inhibitors, and all inhibitors are inhibiting very different complexes. So to learn this, you have to mug up this table, because you don't have so much time to learn, to make concepts, and moreover, you will not have time to apply these concepts also. So here you can see that complex 4 are inhibited by those inhibitors which are ending with IDE. Like this, you can remember in a way or other, like cyanide, carbon monoxide, and this will help you in exams. Then there are certain topics where you need both concept as well as facts, like Leishman syndrome is very important topic. So you should know why there is hyperuricemia, why there is self-mutilation, but there are so many concepts. Along with concept, you also need fact-based learning. For making fact-based learning, you can make some mnemonics. Like for here, we have HGPRTAs. So make such mnemonics which you can correlate. So because they are easier to remember, like HGPRTAs is the enzyme deficient, and also we have made mnemonic for this HGPRTAs. So this way it will be easier for you to remember. Similarly, you can also use PICmonics. So PICmonics are very interesting way of making long-term memory. So here it is a Tay-Sachs disease. Very important question asked recently. So you can see what is in the picture. There is a sack of onions with a cherry red pumpkin too. So with Tay-Sachs, you can correlate this picture sack. And onion peel skin lysosomes are seen in this disease. And there is cherry red spotted macula.
I totally sorry for pitching in, Dr. Gurman. I totally agree with you, because you have to understand that at some places you might apply concepts. Still, you have to memorize certain facts. Like this is a very famous table of Harrison, where almost every year the question is asked to differentiate between tamponade and constrictive pericarditis. Now you understand the concept. You understand why pulsus paradoxus is found in tamponade but not in pericarditis. Why Kussmaul's breathing is present in pericarditis but not in tamponade. You understand the concept. But when a long scenario is given to you and you have to differentiate between two, you cannot start applying the concept. You have to mug up the features of each one of them so that you can answer timely. If you will start applying concept, you will end up wasting a lot of time in single question. And time is the biggest crunch during the exam. And also, you have to understand how much to mug up. In this whole table, you need to remember the clinical characteristics. You need to remember the ECG. It's okay if you don't know the echo or you don't need the CT MRI. So you need to filter out how much to mug up. Besides, as Dr. Gurman said, besides the mnemonic and PICnomic, what we used to do in our time, we used to take pictures of such table and we used to paste it on the walls, especially the areas we used to visit frequently, like a mirror. Now, be it a girl or boy, mirror is a place where everyone visits frequently. Mirror, our switchboards, near our door. so that every time you see those tables, it will fit into your mind. Isn't it, Dr. Gurman?
Thank you, Dr. Shefali, for adding and making it more clear. One thing which I want to add is like this is a purine biosynthesis flowchart. So do you think you can remember this flowchart? You can make a concept about this flowchart? It's very difficult. So for this, you should know the important steps. Like in this, first two steps are important. Second is a rate limiting step that you should know. And moreover, you should know the components which are contributing to the purine synthesis. For that, you can make a mnemonic, or you can, if you can remember, otherwise you can remember. So in this way, by making a strategy to which topics should be studied, by making concepts, by understanding, and which topics need to be marked up, you can get ahead of your competitors. Moreover, you can take help from your mentors, your guides, and as expert faculty of Akash, we are always there to help you. Thank you so much.
Thank you so much, Dr. Gurman, for making it so clear that along with concept, you have to sharpen your memory. There is no excuse for that. And you have to memorize certain, in fact, many facts. Now, second, very common myth among the student population is that whenever we are solving a past year paper, when we see a question which has been frequently asked, or such questions which we have seen already, we tend to just pass them by. We just pass them that ye to aata hai, ye sabko aata hai, but just pass them. We think the actual game is being played on the ground of difficult questions. We think, boss, ye hai game winner. Jisne difficult question kar liye, that person will be the winner. I cannot tell you what a big myth this is. So, Dr. Prachi, I invite you. Can you please make us understand this myth a little better?
Yes, Dr. Shefali. Hello, students. Students, you know, MBBS curriculum mein there are 19 subjects. And NEET PG exam में in 19 subjects से आने हैं 200 questions, which you have to solve in 210 minutes. Now, these 19 subjects comprises of a lot number of topics and subtopics. And if someone asks you to remember each and every topic and subtopic, I don't think ये किसी के लिए भी possible है. I don't think it's possible for a human brain to remember each and everything. Okay, so you need to study strategically. स्ट्रैटेजिकली आपको देखना पड़ेगा कि एग्जाम का पैटर्न क्या रहा है, एग्जाम में क्वेश्चंस किस टाइप के आते हैं. तो अगर हम एग्जाम का पैटर्न देखें तो वी कम टू नो दैट 65 to 75% of the exam questions are from the must know topics from each and every subject. And these must know topics are the one you need to ponder on. You need to spend much of your time and effort during preparation on these must know topics. Like अगर pediatrics is my subject, अगर हम pediatrics की बात करते हैं, if you are not well versed with the topics like severe acute malnutrition, Down syndrome, immunization, tetralogy of Fallot, आप ये सब तो जानते नहीं हैं, and you are sitting and studying L-Kappa, Kabuki syndromes, such kind of topics. So my friends, I should tell you that you are not in the race, and there is no room for such mistakes in this exam. So your aim should be simple. Become flawless with these must-know topics. अब flawless का meaning क्या है basically? Flawless means कि आपको ये must-know topics आने चाहिए with complete accuracy and perfection. इसमें mistake की कोई गुंजाइश नहीं है. Like हम TOEFL की बात करते हैं अगर, if you are studying TOEFL आपने पढ़ा, but आपको TOEFL का tetrad आता नहीं है. You don't know about the peculiar X-ray findings of TOEFL, that is a boot-shaped heart. So then there is no benefit. You must know these must-know topics clearly. Okay. Like इस mock test की बात करते हैं अगर हम, there was a question in the mock test about vesico-ureteric reflux, and it was a multiple option correct type of MCQ, and the options that were given were, one was about the risk factor, one was about the diagnostic procedure, that is MCU, and the grading of VUR, and third and fourth option was regarding the treatment part. One was antibiotic prophylaxis and the other was the surgery. So अगर आपको ये vesico-ureteric reflux ये topic, which all you know is a must know topic in pediatrics, अगर ये आपको thoroughly नहीं आता तो you will not be able to answer this question, and then this is a blunder, students. अगर इस तरह का must know topic वाला question you are answering wrong in the exam, it's a blunder. Okay. Now अब हमारे mind में question arise होता है मैंने बात की 65 to 75% of the question paper is must know. Then what about the remaining 20 to 25% of the questions? They are from may know or nice to know topics. Okay. अब आप सब सोच रहे होंगे कि does knowledge about these questions give you extra edge over other students? Or will these tough, tricky questions decide the top ranks? I think ये question सबके mind में arise होता है. And the answer differs from person to person. सबकी अपनी opinion होगी. But if you ask me, my opinion is that knowledge about these some may know or nice to know questions or the topics, that is not so important. It's not going to fetch you any extra benefit. Because as I already told you, 19 subjects, so much of syllabus, so many topics and subtopics, and it's not possible for any human brain to remember each and every point about these 19 subjects. So हम क्या best कर सकते हैं? हम कर सकते हैं must know topics को, the topics that have been frequently asked in the questions, उनको हम अच्छे से ready करें. What's your opinion, Dr. Farheen, about it? इन दोनों question के बारे में आपका क्या कहना है?
Yes, Dr. Prachi. So while you were talking about the tough cookies, so I got reminded of a question which they had asked 2 years back in NEET exam. It was regarding Robson's classification of cesarean section. आपको पता है Robson's classification क्या है?
नहीं.
I was also not aware of that. So WHO in 2015, they came up with the Robson's classification and they divided pregnant women into different categories basis their parity, their gestational age, previous cesarean section, just to see as to who were at higher risk of undergoing a next cesarean section. So see, if you don't know Robson's classification, it is not going to make much of a difference. But if you don't know what are the absolute indications of a cesarean section, अगर आया कि classical scar था uterus पे, or there was an active genital herpes infection and you go for a vaginal delivery, so that is a blunder. As you said about TOF, कि अगर आपको boot shaped heart नहीं पता है, so it's a blunder. So we cannot, commit these blunders in exam.
Definitely. जैसे डॉक्टर फरीद ने कहा, ऐसे ही in this mock test there was a question regarding the drug of choice for benign childhood epilepsy with centrotemporal spikes. So students, if you commit this mistake in this question, you don't give the correct answer of this question, so there is no problem, because it's not something that I expect that every child should know. But if this question would have been about the febrile seizure or status epilepticus, and तब आप इसका क्वेश्चन का आंसर अगर गलत करते तो स्टूडेंट्स, दिस इज अ ब्लंडर. You need to study harder. You need to think about your strategy for the NEET PG exam.
I totally agree. So master the must know is a must. The thing is, how do we understand कि must knows क्या है? One very simple and straightforward answer is PYQs. So past year questions, they form the central pillar of the must knows. इसके अलावा the common cases which you see in your daily rounds, in your daily OPDs with your consultant, the recent updates, the recent developments, especially in relation to your own country. जैसे Sarvavac, India's first cervical cancer vaccine has been launched in September 2022. So question might not be asked on Sarvavac, but question will be asked on cervical cancer vaccine, because this is something very new. So these all form the part of must know. You have to prepare for the 70% of the paper, students. You do not have to prepare for the 100%. Just be very perfect in the 70%. So all the question banks, like our question bank, I know most about it, but whatever question bank you all might be using, they all have the tags of must know. In Akash, we have a tag called as must know. So whenever you are sitting and studying, especially when you have a crunch of time, filter out what's important for you. Just see, preferably just master first of all these must know questions, the questions which have tagging of integration, tagging of clinical scenarios and image based, just master those first. Similarly, in our notes, we have special highlighting of the past year topics and also the important topics. I'm very sure that in your notes also it might have been there. So just when you are reading those notes and you are in a crunch of time, just see those highlightings and master those first. So that's a very important concept which you all should know. This brings me to the second secret ingredient, and that is importance of taking test. Why is every faculty focusing so much on take the mock test, take the mock test? Why I cannot sit in my room, study a topic, silently do 10 questions, jo past mein puche gaye, why I cannot do that? Why do I every time or every week have to sit on a time bomb for that? So I'll tell you a story. ठीक है, बहुत theory हो गई है. Let me tell you a story. थोड़ी माइथोलॉजिकल स्टोरी है. क्या होता है, एक बार इंद्र भगवान बहुत नाराज हो जाते हैं फार्मर्स से और वो कहते हैं कि मैं 12 साल तक बारिश ही नहीं करूंगा. फार्मर्स बहुत दुखी होते हैं, जाते हैं इंद्र भगवान के पास, कहते हैं प्लीज आप ऐसा मत करो, आप बारिश कर दो. बट वो कहते हैं नहीं ऐसा नहीं होगा. बट वो उनकी रिक्वेस्ट पे कहते हैं कि ठीक है, एक कंडीशन है, अगर शिव जी अपना डमरू बजा देंगे तो मैं बारिश कर दूंगा. तो फार्मर्स कहते हैं ठीक है, वो शिव जी के पास जाते हैं. बट साइड से इंद्र भगवान शिव जी को बोल देते हैं कि आप 12 साल तक डमरू नहीं बजाएंगे. फार्मर्स वहां जाते हैं, वही जवाब मिलता है डमरू. भगवान कहते हैं मैं तो 12 साल तक डमरू बजाऊंगा ही नहीं. बेचारे वापस आ जाते हैं, वेट करते हैं बारिश का. एक फार्मर था जो हर रोज अपने फार्म में बीज उगाता था, उसको प्लो करता था, जैसे कहते हैं खेत को जोतना, वो करता था, अच्छी खादों के बारे में पढ़ता था, सीड्स लाता था. हर साल उसकी क्रॉप नहीं होती थी बिकॉज देयर वाज नो रेन. और वो 3 साल तक ऐसे ही करने लगा. लोग उसे पागल कहने लगे. पीपल यूज्ड टू कॉल हिम मैड. स्टिल ही वाज डूइंग इट. वन डे मैन आस्क्ड, व्हाई आर यू डूइंग दिस? यू नो कि रेन नहीं होने वाली है, क्रॉप नहीं होगी, व्हाई आर यू डूइंग दिस? ही सेड, आई एम स्कैर्ड कि ये ना हो कि जब रेन हो मैं बीज उगाना भूल जाऊं, ये ना हो कि मुझे याद ही ना रहे कि पौधा उगाते कैसे. आई एम प्रैक्टिसिंग फॉर द डे व्हेन इट विल रेन. And that's what you have to do. You have to practice for that day. So basically, the practice is the one which makes you perfect. You have to win the game during the practice, not during the performance. Whenever cricketers are practicing on a field, they don't think of, let's play well, but we will win in the performance. They try to win every single game during the practice. And that's what it is. Whenever you are marking any answer wrong in your question, so you know there are 2 types of mistake which you are doing. One is conceptual mistake and one is non-conceptual. Conceptual वो mistake है जिसका concept आपको नहीं मालूम था. You didn't knew about it and you read it wrong, or when you applied wrong concept and you in the end marked it wrong. Non-conceptual वो mistake है about which you knew the concept, you are very well versed with it, but still you marked it wrong. And now don't tell me ये नहीं होता, ये सबके साथ होता है, ठीक है? But why it happens? Because of 4 things. These are interrelated, different things. Lack of concentration, overconfidence, you are in too much hurry, and you did not read the question properly. Because of all these 4 things, एक आता हुआ question you mark it wrong. इसको हम कहते हैं exam temperament. When you are sitting on exam table, you are filled with adrenaline rush. Your heart is running at 120 beats per minute, and that leads to non-conceptual mistake. And there is only one method of minimizing these mistakes, removing your exam temperament, and that is simulating the real exam conditions again and again. You can very well practice in your room, but unless you simulate the real exam conditions, your non-conceptual mistakes will never be minimized. And take it from me, जो guilt non-conceptual mistakes करने का होता है, जो questions आते थे उसको भी गलत कर दिया, जो guilt उनका ये mistakes करने का होता है ना, वो guilt आपका कभी नहीं जाएगा. If you want to save yourself from that guilt, give mock test repeatedly.
That's a very important point that you said, Dr. Shefali, that हर exam से पहले tachycardia तो होगा ही होगा, no matter how many exams you take. And there's a very important point that you came across with, that game is won at the time of preparation, yeah, at the time of practice. So what will help you practice well? The things that will help you practice well is that if you stay focused and if your preparation is structured. So I would like to stress upon the importance of timetable over here. Now, timetable will do 2 things. It will help you, tell you what is the expanse of the topic that you need to cover, and it will also structure your preparation. All right. Next slide, please. So on an average, it was seen that a medical student studies for 3 to 4 hours after college. हम बहुत ज़्यादा पढ़ते हैं, we medicos, right? So we study in college also, and after that we also studying for 3 to 4 hours. So that is approximately 240 minutes. And if you were to cover like 2 or 3 topics, and if they had 24 pages, so this is a rough estimate just to give you as to how much time you have. So it's like 10 minutes per page. And you have so many topics to cover, my dear students. So you would actually realize that you don't have time. So when you start studying, initially your output will be less. You might feel that you bahut dheere chal raha hai, and you might panic. So don't panic. Just know one thing, that you are building your concepts. You are understanding things for the first time, and it is going to take some time. And with every revision, you will gain speed. So in the first read, what is important is you understand the gist of the topic. and you jot down the important points which are necessary for your first revision. This is very important. ऐसा नहीं होना चाहिए कि आपका first revision आ गया and again you are giving as much time as your first read. Also, it is very important to revise volatile topics at regular interval because this will give you a boost of confidence. ये सब कुछ एक confidence का ही game है. It is nothing much. Now, I've also seen students saying that, see, I was not able to study on that day. वो मेरा दिन बर्बाद हो गया. It was not at all productive. You will realize yourself that if you have not studied for a day, next day when you start studying, so your output is double and you come back with a bang. So was it a productive day? It was definitely a productive day, dear students, because it helped you detoxify, right? It was not able to give you a substantial output, but it was 100% productive. Timetable की यहाँ पे बहुत importance है because timetable will help you stay on track. When you're setting up your timetable, so आपने NEET UG भी crack किया है, आप यहाँ तक आए हो, I need not tell you how to set up a timetable, but I'll just give you few pointers which help me crack my exam. So set slightly stretched target. What do I mean by this? That if you're able to cover 5 topics in a day, so cover 5.5 or 6 topics, because that will maintain a basal anxiety in you. And by the end of 2 or 3 months, you'll see that you had covered a lot of topics because the target was a little stretched. Also in the timetable, try to cover important points in the beginning so that when you're in the middle of the subject, you are again confident that you have covered majority of the part which was difficult. It is very important to keep buffer days because हम जितना सोचते हैं उतना cover नहीं हो पाता है, and buffer days will give you extra days to cover whatever you have left. Now, what are you going to do if you were not able to cover that topic on your buffer days, right? So what I used to do was, I used to move on to the next subject as per the timetable because unnecessarily वो चीज खिंचती जाती थी, and I used to feel that I'm wasting my time. In the next revision, what you can do is that you start from the topic that you had missed in your first reading, and as it is, you had completed a majority of your part in the important part in the first reading, so you will be confident enough, right? Yes, Dr. Gurman?
Dr. Farheen, one question which is on every student's mind is, how many revisions are enough?
That is a very important question. जितना भी revision कर लो मुझे लगता है enough नहीं होता है. As a student when I was studying, so I always used to feel कि यार मैंने तो बहुत कम पढ़ा है. My roommate or my teammate has, studied a lot. So how many revisions are there? Generally, first is your first read. After that, on an average was seen and has spoken to many students, many toppers. So there are 3 revisions. That will again be an individualistic approach. It will again depend whether it's a major subject or a minor subject. It would also depend on whether in which topic you're strong or weak in. In weak topics, you need to revise more. Volatile topics, you need to revise more. आपका weak topic मेरा strong हो सकता है, मेरा strong आपका weak हो सकता है. So that is an individualistic approach. In the last 15 days, what is generally recommended is that first revise the strong topics. Again, it will give you confidence that you have covered something. Next, moderately weak topics. And towards the end, keep more days for the topics in which you think that you are weak in and the topics that are volatile. Now, since we're talking about timetable, it's just a quote that I would like to tell you that जब आप prepare कर रहे होते हैं, your parents are there, your relatives are there, कि क्या हुआ exam में, and there's so much of pressure around you, right? So you don't have to explain yourself to everyone. Time will.
Thank you so much, Dr. Farheen. Thank you so much, all of the faculties, for such a valuable input. I have with me the topper results of the webinar of the mock test, so I'll announce them first. But first of all, before listening to the result, all of your toppers, all of you who chose to dedicate your 3 hours to a mock test, who chose to be in the webinar on a Sunday evening, it shows that how dedicated and how perseverant you are towards your NEET PG goal. So half of the battle is already won. Half of the battle is actually just showing up. So it's just half of the one which is remaining. So the toppers are, first rank is Dr. Lucifer from Medical College Ahmedabad. Congratulations. Next, Dr. Manish Soni from Medical College Baroda. Congratulations, Dr. Manish. And then Dr. Hardik Chaudhary from Baroda. Congratulations to all of you. Our team will connect you within 24 to 48 hours for prize money. So all of you are winners, as I have said, because what is important is your dedication and your focus, which you have already shown. So coming back to the webinar, what we discussed in the start was the recipe, and then we came to ingredients. You might be wondering, okay, these ingredients are important, but definitely they are not a secret. This is something which everyone is telling you, and this is something which you already know. But problem to yahi hai. If these are the ingredients which everyone know, why everyone is not performing very well? Why the outcomes are so different? If this is known to everyone, this is where comes the secret recipe. Sirf ingredients ka pata hona kafi nahi hai. That thin line which is there between an achiever and between the average student, that thin line you have to know. You know what is that thin line? It is the belief. Your belief in yourself and in your own strategy. जो आपका रूम पार्टनर है, who is doing very well, उसके पास जो भी स्ट्रैटेजी है, चाहे वो उसकी अपनी बनाई स्ट्रैटेजी है, चाहे उसने शायद किसी सीनियर से कॉपी की है, or else the strategy has been taken from a mentor, from wherever he has got the strategy, he has a very good belief in that strategy and he is working on it right now. He is not confused. Whereas if you do not believe in your strategy, in yourself, you are confused. You will not even realize the exam date will come and you might not have selected what strategy I should work on. So actually the secret recipe is actually you. You have to believe in yourself. After today's webinar, if you think I don't agree with the faculty, that's okay, but believe in that. Don't get confused. If you think that I totally agree with the faculty, then believe in it and work on it with your whole heart. So just have a belief in yourself. You're very focused and very dedicated. Just have this belief and you will not even realize how beautifully you will come up in NEET PG. So that's it from our side. And now we'll be very happy if there are any questions. We'll be very happy to cater the questions if there are any. Thank you. So I think we'll wait for another 2-3 minutes. So if there'll be any questions, we'll deal with them. If not, you can always connect to our team for any questions you want to ask. Personally, we at Akash PG are definitely there to mentor you, to help you always.